Hi dear colleagues, I'm Annastacia Mbisi, lecturer at Kirinyaga University. Welcome to my presentation on utilization of Partograph in management of women in labor among nurses working in Embu County. Background information. A Partograph is a graphical presentation of the progress of labor and of fetal and maternal condition during labor. It provides a pictorial overview of labor, alerts midwives and obstetricians to any deviation in maternal or fetal well-being and the progress of labor. Partograph is an effective tool for monitoring labor, reducing labor complication, especially in developing countries such as Kenya. The different variables of Partograph include fetal condition, status of membrane, quality of liquor, the degree of molding of the fetal head, among others. In Kenya, maternal mortality ratio and neonatal mortality rate is high, estimated at 510 per 1,000, 1,000, 100,000, and 22 per 1,000 live births. Utilization of Partograph brings about gross reduction in the number of deaths by ensuring that complications are detected early for prompt intervention, thereby enhancing maternal and neonatal well-being. Statement problem. A study done in Kenyatta National Hospital on Partograph use revealed that Partograph were incomplete, incorrectly filled, or not used at all. A retrospective survey of health records from selected health hospitals in Embu County in regards to Partograph utilization revealed that 100% of the record had a Partograph attached, with only 40% of them used correctly up to delivery. Research objective. Broadly, the study seeks to establish utilization of Partograph in management of women in labor among nurses in Embu County, specifically determining 1. Level of utilization of Partograph charts among nurses in Embu County. Second, nurses related factors influencing utilization of Partograph. Research methodology. Research design was cross-sectional design. Study area was Embu County. In selected health facilities, the study population was nurses working in maternity department within the selected health facilities. Research instrument was structured interview, focused group discussion, and key informant interview. Data analysis and management. Data was analyzed using the statistical package for social sciences software version 23. Quantitative data was summarized using descriptive statistics such as frequencies and presented by use of tables and figures. Logistic regression was used to test association between variables and level of significance. Results from focused group discussion were categorized into common themes from which inferences were made and conclusions drawn during the thematic analysis. This qualitative data was used to supplement, explain, and interpret quantitative data. The results. The study targeted a sample size of 124 nurses, from which 110 filled in and returned the questionnaire, making a response rate of 88.7%. More than a half of respondents, that is 7.9%, were female. The mean age was calculated to be 26 years, and nearly a half of them, that is 52.7%, were within the age group of 25 to 30 years. On level of utilization of Partograph among nurses, the study revealed that majority of the nurses, that is 55.5%, did not duly complete the Partograph charts available in the labor ward. This was attributed to a number of factors ranging from nurses-related factors and health institution factors from where they were working. On nurses' knowledge on use of Partograph, a number of variables were used on nurses' knowledge on Partograph use. This was assessed based on specific question. Each correct response was awarded 1 point, while incorrect response attracted. Majority of respondents, that is 80%, were able to define a Partograph. Out of these, 44% of them had duly completed the Partograph charts, while that 9 of them never made use of the available charts. A considerable portion of the respondents, that is 87.3%, were able to tell when to start plotting a Partograph. More than half of respondents, that is 67.2%, knew the meaning of alert line. These were also not significantly associated with the use of Partograph at p-value of 0.69, while 72.7% of respondents knew the function of an action line and were able to explain its meaning on a Partograph. On how often the Partograph is used, the nurse in charge reported that Partograph were used regularly. And I quote, "Partograph are often used to monitor the progress of women in labor on regular basis." And this was from a key informant from Kirinyaga Hospital. Generally, 7% of respondents knew when and what to use Partograph for, and reported to have used a Partograph before the time of study. Only 72.7% of respondents exactly knew that a Partograph is started when the cervical dilatation is at 4 centimeters. To improve on knowledge on Partograph use, 80% of the nurses wanted to receive a refresher training on Partograph use. This was elaborated during focus group discussion in Kirinyaga Hospital when one member quoted, "We are taught these things in college, but we never practiced, and after working in other departments as a nurse, you need a refresher training on the use of the charts." When general knowledge was computed and a logistic regression done, it was found out that knowledge on Partograph use was significant at a p-value of 0.001. Majority of those who had good knowledge were 5.6 more likely to practice Partograph use compared to those who had a poor knowledge. On the nurse's attitude towards use of Partograph, on this respect, a Likert scale was used. 4 statements were used to assess the attitude of nurses. On the first statement, 17.3% of the respondents strongly disagreed that a Partograph can reduce newborn and maternal morbidity and mortality rate. About 13.6% disagreed, 26.4% agreed, 29.1% strongly agreed, while 13.6% were neutral. On the assessment of Partograph can be used in whole labor, 16.4% strongly agreed, 60% agreed, 8.2% disagreed, 1% of respondents strongly disagreed, while 13% were neutral. Majority of nurses, that is that 3.6%, reported the use of Partograph was time consuming. And 15.5% of the nurses also agreed that the use of Partograph took a lot of time they could have used to monitor the mother. 14.5% of the respondents were neutral if the filling of the Partograph charts was time consuming, with 17.3% disagreeing that using the Partograph was time consuming. In the same report, 19.1% of the nurses strongly disagreed that use of Partograph was. On focused group discussion, I revealed that supervision among nurses could make nurses to utilize the Partograph. And I quote, "Nurses working in maternity needs to be supervised and monitored frequently in order to be reminded to make utilization of Partograph as a routine." This was from a nurse from Kirinyaga Hospital. On general assessment of nurses' attitude on use of Partograph revealed that more than half of respondents, that is 74, had a negative attitude, and only 24 of these respondents had a negative attitude and filled the Partograph. However, out of that 6 respondents who had a positive attitude, that of them had filled the Partograph. On a computation of these results, attitude of the nurse was significantly affecting use of Partograph at p-value of 0.0. In conclusion, nurses-related factors influencing utilization of Partograph includes negative attitude and lack of training on Partograph use. Majority of nurses working in labor ward felt that Partograph use is time-consuming and needed supervision on Partograph use. In addition, majority of the nurses were not trained on Partograph use from the time they had graduated from college. Recommendation: the study recommends policymakers and nursing administrators to ensure that all qualified nurses use the Partograph in the care of women in labor. Thank you.